So in the past, it was all about trying to figure out whether or not the patient was a germline carrier, and if they were, what that implication would be for their offspring. So with that knowledge, it's much easier to test the family because we know where the mutation is. So the testing is cheaper, it's more directed. And it allows us, even if they choose not to, the individuals choose not to get tested, there's still some counseling that can be done in terms of how to lower their individual risk. But in the recent years, with the development of the PARP inhibitors, and I think a much better understanding about how DNA repair happens in this whole homologous recombination deficiency area, that's really exploded since the development of this class of drugs. There's a personal benefit, and that allows us to use or kind of get in these novel drugs, of which olaparib is already approved now in the BRCA mutation population. But upcoming very soon are going to be multiple different drugs that'll have different indications where this will be really relevant. The other thing is that the way we did it before was to essentially try to look at family histories, and with very large families we can get a very good idea about what the individual risk is. And the point was that if we felt there was at least a 10% chance of finding a mutation for germline sequencing, then we would do it, and if it was less than that, then we would just offer general counseling. But now we understand that the families are not that large, we don't have good detailed history, lots of missing information, and so we found that in the lower risk predicted risk, we miss the majority of the patients that would be BRCA positive. So we have made a very strong effort to say that the traditional reasons, so that would be the downstream progeny counseling, the personal benefit, and then for not only for the availability of these BRCA testing, but understanding that these patients also are much more likely to respond to DNA damaging agents in general. So it's become, because of those factors, we now recommend that they get it done at diagnosis.